Welcome to part two of Seeing a Boat with Nurse Linda. Today we're talking about breast cancer and breast cancer month. And right now we're talking about
We're going to talk about the risk factors associated with breast cancer. Who is most likely to develop the disease? First and foremost is anyone can get breast cancer at almost any age. I've treated women in their 20s who have been diagnosed with breast cancer.
what caused it.
Number one, first and foremost, is the genetic component to it. Is there a family history? And cancers with strong family histories tend to develop 10 years earlier in each subsequent generation. And this is where we see the women in their 30s and their 20s with breast cancer. So if you have a strong family history, be aware of that and start your screening early. Now, women who are young have more of a difficult problem with screening, and we're going to talk about that next week with screenings and what's appropriate at what ages. But one of the things they've identified are two genes that are connected to breast cancer, and they're called the BRCA1 and the BRCA2. Having one of those genes can predispose you to cancer. It doesn't mean you will get cancer, and anybody that has these genes should not be running around getting double mastectomies and things like that. 1 in 200 women in this country carry one of those genes. Again, it's a matter of being aware and understanding how it fits in your family. So that's first. The other thing that puts you at risk, once again I'll raise my hand for that, is over the age of 50. Puts you at a much higher risk for developing cancer. And again, it's just part of the aging process. It's sort of like as we age, the arms flab, the neck flabs, it's just part of what we do.
Haven't they reduced the availability of that breast camera thing?
The mammogram.
I know.
Yes. They have not reduced the availability of it, but they're making changes on it. And that's what's going to be in next week too. We're going to talk about how those screening guidelines are changing, and depending on your doctor's take on things, what he may or may not recommend for you as far as screening goes. So we're going to kind of give everybody a clear overview of that part of it. African American women are more likely to develop breast cancer before menopause. And that's a very important piece to remember. That means they're developing at a younger age versus the non-Hispanic white women. Very important to think about. Other risk factors include, which I had forgotten about over time, if you begin your menstrual cycle before the age of 12.
That's happening because of food and environment.
Yes, because our bodies normally cycle with estrogen and progesterone as we age and as we go through our normal changes in life. If you're starting that and soaking the body with these hormones earlier, you're more likely to develop breast cancer. The other thing is if you have your first child after the age of 30.
Which is happening more and more today.
Exactly. You are more likely to develop breast cancer. Now remember, when we talk about more likely, we're not saying you will, but you have that possibility. So screening becomes very important. The other thing is if you stop your menstrual cycle after the age of 55. So if you don't go through menopause at the average age, so if you, again, it's because those hormones are in your body for a longer period of time. Your body wasn't meant to do that. Also, one thing I did not realize, I learn something every time I do these.
Yeah,
yes.
So do I.
If your menstrual cycles are shorter or longer than the normal 26 to 29 days, you may be at a higher risk for breast cancer. So again, discussing that with your doctor, with your gynecologist, so that you can go through appropriate screening is very important. A couple things to remember is birth control pills had a very bad rap for a while as to possibly increasing the risk of breast cancer. They have almost conclusively now been shown not to contribute to the incidence of breast cancer.
That's interesting.
That's a very good thing to know, especially with the newer birth control pills, lower doses and different hormones in there and everything. So that's important to know. If the doctor suggests hormone replacement therapy for you, and you are on it for more than 5 years, you need to have that conversation with your doctor. Should you really continue it?
What was the reason for taking hormone replacement?
Someone who's at a young age and goes through a hysterectomy, they have all of their female organs removed. It will put them into what we call surgical menopause. So it puts you through terrible hot flashes and sleepless nights and leg cramps and everything else that the rest of the population would normally go through slowly as the hormones start to decrease slowly. They're put it all at once. So hormone replacement therapy for some women is very beneficial. Some women have a really difficult time going through menopause and have difficulty dealing with those side effects and things. So that's where the hormone replacement therapy is helpful for them as well. It again guides them through that slowly until they get to that point. Some other things that have been touted over the years is antiperspirants, brassieres,
Antiperspirant. You used to have what, aluminum in it or zinc?
aluminum, and they say that, or it plugged up the ducts and all kinds of things. There has never been any evidence that conclusive evidence that antiperspirants have anything to do with breast cancer. Look at the population that uses antiperspirants. There would be a much higher incidence than what we have. So no. The other thing is brassieres. That was running around for a while. That brassieres caused breast cancer, or ill-fitting brassieres. That has nothing to do with it. Yeah, they have not shown any incidence whatsoever. Women that have had abortions or miscarriages at a higher rate of breast cancer has not in any way been shown
Another urban
to contribute to
legend.
it. Yes, many urban legends. Breast implants have not been shown to increase the risk of breast cancer. Chemicals in the environment have not been shown conclusively. Now that doesn't mean that individual chemicals may not contribute, but in general. Tobacco smoke, they're still out on the fence with that one, because earlier studies showed that it did not contribute. Newer studies have shown that it may be contributing. So they're still on the fence with that one. Either way, nobody should smoke.
Yeah.
It
Yep.
shouldn't take. The other risk factors that women should be aware of are obesity. If you tend to be very overweight, you have an increased risk of breast cancer. And if you drink a lot of alcohol, women tend to have a higher risk of developing breast cancer.
And heavy men have breasts, really. Go to the beach and watch Uncle Joe. They're terrible, you know. Alcohol.
Alcohol, yes. And that's more than 2 drinks a day is what they consider excessive.
What do they consider a drink?
Usually about 6 ounces of something. So, and that includes beer, wine, any liquor. So that's where we're at. Understanding the risk factors and reducing as many risk factors as possible is very important. And hopefully we'll keep each other safe and healthy.
Okay, what's our next segment about?
We're going to talk a little bit about what Brook Healthcare is doing out in the world.
Oh, that's right. You were at a Rotary Club yesterday.
Yes, and people are going to be able to find that at the top of our website, not down at the bottom with these other videos. So go there and keep up to date with what's happening on a weekly basis.
Cool.
Yes.
You guys are doing exciting stuff. You were listening to Senior Moment with Nurse Linda on the STRN network. We'll be back with Nurse Linda again, talking about Nurse Linda.